Hi, everyone. The disease process we'll be reviewing for this week's discussion is metabolic acidosis. Metabolic acidosis is a commonly seen process that's easily identified by both clinical presentation and laboratory testing. Metabolic acidosis is caused by a decrease in sodium bicarb levels and an increase in hydrogen ions. Typically, the pH decreases, so it'd be less than 7.35 is considered acidotic. But depending how effective the respiratory system is in compensating, the pH could be normal or even high. This is especially true if it's a mixed complex acid-base disturbance. One of the most common causes of metabolic acidosis is a decrease in pH caused by diarrhea. With diarrhea, the bicarb ions are lost excessively from intestinal secretions that results in an acidosis that's reflected on the blood gas. Metabolic acidosis can also be caused by renal failure, either an acute kidney injury, an AKI, or a chronic kidney disease. Can also be caused by lactic acidosis in sepsis, poorly controlled diabetes, or ingestions of other medications or toxins. Some commonly ingested substances that result in metabolic acidosis include aspirin and ethylene glycol. With sepsis, the body's blood pressure drops as a result of an infection, which leads to a release of lactic acid. As a result, there's insufficient oxygen delivery, which leads to tissue hypoxia and anaerobic glycolysis. Anaerobic glycolysis is a compensatory mechanism that occurs when there's limited amount of oxygen available. Glucose transforms to lactate, which is why we see an elevated lactic acid level in septic patients, in addition to a metabolic acidosis. In uncontrolled diabetes, the patient produces a large amount of keto acids that eat up the bicarb ions, which results in a drop in the serum bicarb levels. The body's compensatory mechanism for metabolic acidosis is rapid deep breathing. This type of breathing is referred to as Kussmaul respirations, which is a common telltale sign of DKA, but it's also present in metabolic acidosis where decompensated diabetes is not the cause. Headache, lethargy, weakness, and confusion are the major symptoms of metabolic acidosis. These are symptoms that we should consider when the patient presents that would indicate we need to get a blood gas. The symptoms can progress rather quickly if there's not early treatment. Without getting too far into it, early treatment's based on treating the underlying cause of the acidosis. So, for example, treating DKA or renal failure with measures like an insulin drip and fluid resuscitation for DKA and urgent dialysis for those in acute renal failure. So the only treatment for metabolic acidosis is to treat the underlying cause. The progression of metabolic acidosis symptoms without treatment can lead to a coma and ultimately cardiac arrest. Patients at risk include those with tenuous diabetes, chronic renal failure, and those exposed to a virus or bacterial infection that if left untreated can lead to a sepsis. And while the patient's clinical picture, such as the headache, lethargy, and weakness, is an important diagnostic criteria, the only definitive way to diagnose this condition is by laboratory testing of serum electrolytes and blood gases. An arterial blood gas is the most accurate way to measure the pH, PaCO2, and bicarb, but you can also use a venous gas, which is commonly done in the emergency department, just because the arterial gas is a more invasive procedure. In a metabolic acidosis, we expect to see a low pH, so less than 7.35, and a low PaCO2 with an associated low bicarb. Urine studies also demonstrate a low pH. If the acidosis is due to DKA, there will be ketones present in the urine. What can be misleading is the pH has potential to be normal, especially if the metabolic acidosis is compensated. So for reference, the normal pH is 7.35 to 7.45. But if the acidosis is decompensated, the serum pH would be low, so less than 7.35. Another important number to look at is the anion gap. A normal anion gap is 12. So if the anion gap is greater than 12, the diagnosis is referred to an anion gap metabolic acidosis. I hope this information was helpful for you guys. Good luck with studying this week.